My name is Shannon Cook. I'm a professor at Purdue University teaching in the School of Nursing. Cold and flu season starts typically in the fall and lasts throughout the winter and into early spring. Usually we see the bulk of activity between December and February. February is certainly still a time to be vigilant in preventing flu infection. According to CDC data, over the past 40 years, February is actually the most common peak month that we see. So it's really important as we get into February and we're going into indoor close contact situations that we keep this in mind. Group gatherings like the Super Bowl do increase the spread of illness due to the fact that people are in close contact in confined quarters. Typically there's a lack of airflow, there's not as many open windows and doors due to cooler temperatures. In these situations, when even one person is sick, it can dramatically increase the risk of transmission. In fact, we start to see that these events, sometimes known as super spreaders, can result in large amounts of people becoming infected. Prevention is key when it comes to flu season. Some of the best measures you can take are things that you need to do before symptoms appear. The first one's really easy. It's washing your hands. Hand washing alone can reduce the risk of respiratory infections by up to 20%. The second thing you can do would be to get the recommended flu vaccine, which comes out sometime between August and September and is given all the way through March. Typically, the flu vaccine takes about 2 weeks to be fully effective, and when given, can give up to 40 to 60% risk reduction in severe flu cases or flu-related deaths. As sad as it is, when people feel sick, they should stay home. The reason for this is that often the people that we most want to see are also the people who could be hurt the most by severe illness. So this would include new babies in the family, elderly family members. In these circumstances, although it's hard to miss out on important events, it's best to keep vulnerable populations safe. You should remain home until your symptoms are improving and you have been fever-free without the use of medication for greater than 24 hours. During the course of illness, typically days 3 through 5 are when most patients are most contagious. So it's really important to take note of that. Even if your symptoms feel mild, you could be putting other people at risk. Simple habits can make a big difference. So cleaning high-touch surfaces frequently can help prevent the spread of infection. Covering coughs or sneezes, whether that be with a hand or an elbow, can also help to prevent transmission. Other options would be to make sure that you have proper ventilation in the home, so opening doors and windows where possible, or having an air filter in your room can sometimes help with those things as well.